For taking care of an indwelling catheter, you would want to make sure that you have all of your supplies, a basin with water. Make sure that you ask the resident if the water is at an okay temperature for them. You'll need to have gloves and 3 cloths, one for washing, one for drying, and one for washing, one for rinsing, and one for drying. Your gloves, and then you need a linen protector to put underneath the resident. So once you have all of your supplies, you're going to have the resident roll over onto one of their sides, and then you're going to take the linen protector and you're going to place it underneath of them, roll them back to a supine position, and then you're going to have them bend their knees up a little bit and separate the legs. Make sure to only expose the area that you will be working with. Do not expose anything that does not need to be. Once the resident is ready, you will take one of your cloths and you'll put it in the water and then get soap on it. You're going to, with your gloves on, grab the catheter tube at the entry point. Make sure you're not pinching it. Make sure the tube isn't pinched underneath the resident. There's nothing tangled or anything like that. With your soap cloth, you are going to take it, and in a downward motion, you are going to swipe 4 inches down the catheter tube. You are going to fold your washcloth. Again, grab the tube at the entry point. You're going to wash the other side of the tubing and continue on until you have all the sides of the tubing washed. And then you are going to get a rinse cloth and again grab the tube at the entry point, just like when you were washing it. You're going to go in a downward stroke 4 inches down the tubing of the catheter, making sure to change your cloth to a clean side for each downward swipe. And then you are going to take a drying cloth holding the tube, and you are going to dry that tube down where you washed. You can then perform perineal care as needed for the rest of the resident. Once you're finished with that and it's dried, you take your supplies, move it over to an area away from the resident where it won't contaminate anything else. You will have the resident roll back onto their side so you can remove that linen protector and then return them to a supine position. Make sure that when you're done, the resident is comfortable. Ask them if there's anything else that they need from you, and make sure the bed locks or bed breaks are locked if needed. And if the resident doesn't need anything else, you can dispose of your supplies.